Have you ever noticed someone with teeth that seem to stick out a little more than usual? Or maybe you've heard the terms overbite and overjet but weren't sure what they really mean. In today's video, we're going deep into these common dental conditions, what causes them, how genetics plays a role, and how habits like thumb licking and bottle use can contribute. Let's get started. Alright, let's break down these terms. Imagine looking at someone's profile like a side view of their face. Overjet is all about the horizontal overlap. It's how far the upper front teeth stick out or protrude past the lower front teeth. Think of it like this: if their top teeth could almost give their chin a high five without the lips in the way, that's a pretty significant overjet. Now, overbite is about the vertical relationship between the upper and lower front teeth. It's how much those upper front teeth overlap the lower teeth when you bite down. A little bit of overlap is normal actually, but when we're talking about an overbite, it means that overlap is excessive. To give you a visual, imagine biting into a sandwich. With a normal bite, your top teeth would slightly overlap your bottom teeth. But with a deep overbite, your top teeth might cover a significant portion of your bottom teeth, almost like they're trying to hide them completely. And here's the thing. Overjet and overbite often go hand in hand. Someone with a significant overjet is also likely to have some degree of overbite, but it's important to remember they are distinct conditions and can occur independently. So, why do some people have these bite issues? Well, as with many things in health, it's a combination of factors. Genetics definitely plays a role, but so do our habits, especially during childhood when our jaws and teeth are still developing. Let's face it, genetics plays a huge role in how we look, and that includes our teeth and jaws. Just like you might inherit your mom's curly hair or your dad's eye color, you can also inherit their jaw structure and tooth size, which directly impacts your bite. If one or both of your parents have a significant overjet or a deep bite, chances are higher that you might inherit a similar pattern. Think about it. Jaw size and shape are largely determined by your genes. Some people naturally have a larger upper jaw, also known as the maxilla, or a smaller lower jaw, called the mandible. This difference in size can create a discrepancy in how the teeth align, leading to an overjet or overbite. And it's not just the jaw bones themselves, the size of your teeth also plays a role. Imagine trying to fit large furniture into a small room. It just doesn't work. Similarly, if your teeth are proportionally larger for your jaw size, it can lead to crowding and misalignment, contributing to bite issues. Now, it's important to distinguish between skeletal and dental issues. Sometimes the underlying jaw bones themselves are misaligned, which we call a skeletal issue. This type of misalignment is often more pronounced and might require more complex treatment. On the other hand, a dental misalignment means the teeth themselves are out of place, but the jaw bones are relatively well aligned. This is often easier to address with orthodontic treatment. And here's something many people don't realize. Certain genetic syndromes can actually influence jaw development and bite. For example, conditions like Marfan syndrome, Pierre-Robin sequence, and Down syndrome can sometimes present with overbites or other craniofacial differences. It's a reminder that genetics is incredibly complex and impacts us in countless ways. Chapter 3. Environmental and habit-based causes. It's not all in your genes. While genetics lays the groundwork for our dental structure, our environment and habits, especially during childhood, can significantly influence how our bite develops. Think of it like this. Imagine a tree growing up leaning towards the sunlight. Our habits can act like that sunlight, influencing the direction our teeth and jaws grow. One of the biggest culprits is thumb sucking. We've all seen adorable babies with their thumbs in their mouths, but that constant pressure from the thumb can actually push the upper front teeth outward, leading to an overjet. And it's not just the teeth. Thumb sucking can also interfere with the natural tongue posture, which is crucial for proper jaw development. Over time, it can even reshape the palate, making it narrower and further contributing to alignment issues. Prolonged bottle use and pacifiers can have a similar effect, especially if they're used beyond the recommended age. The sucking motion encourages a tongue thrust swallowing pattern, where the tongue pushes against the teeth instead of resting on the roof of the mouth. This constant pressure can gradually push the front teeth forward, leading to an overjet. And believe it or not, even something as simple as breathing can impact our bite. Mouth breathing, as opposed to nasal breathing, can alter the tongue's resting position and affect how the jaw grows. When we breathe through our mouths, the tongue doesn't press against the roof of the mouth as it should, which can contribute to improper dental alignment. Speaking of tongue posture, it plays a much bigger role in oral health than many people realize. Ideally, the tongue should rest against the roof of the mouth, applying gentle pressure that helps develop the palate and guide tooth eruption. However, if the tongue rests on the bottom of the mouth or pushes against the teeth, it can disrupt this natural balance and contribute to bite problems. And finally, let's not forget about the muscles in our face and mouth. Weak lips or muscle imbalances, sometimes due to neuromuscular conditions, can also affect tooth position. These muscles play a crucial role in supporting proper jaw alignment, and any weakness or imbalance can allow the teeth to shift out of place. Chapter 4. Effects of overjet and overbite more than meets the eye. You might be thinking, okay, so my teeth aren't perfectly aligned. Is it really that big of a deal? Well, here's the thing. Overjet and overbite aren't just cosmetic concerns. They can actually impact your oral health and overall well-being in several ways. First and foremost, misaligned bites can make it surprisingly difficult to chew food properly. Think about it. Your teeth are designed to work together like gears, efficiently grinding and crushing food. But when your bite is off, this intricate system is thrown out of whack. You might find yourself chewing longer, struggling with certain foods, or experiencing jaw fatigue after meals. And it's not just chewing that's affected. Overjet, in particular, can also make it harder to pronounce certain words clearly. The position of your teeth plays a role in how you form sounds, and when your upper teeth protrude significantly, it can create a lisp or other speech impediments. Another concern is the increased risk of dental trauma. Just imagine tripping and falling. If your upper teeth stick out, they're more likely to take the brunt of the impact, potentially leading to chips, fractures, or even avulsions. That's a dentist's way of saying knocked out tooth. Not a fun experience. And if you're thinking, okay, but I'm careful, so I'm good, hold on a second. Overbites, especially deep overbites, can put excessive strain on your jaw joints, increasing your risk of developing temporomandibular joint disorder, or TMD. This condition can cause chronic jaw pain, headaches, clicking or popping sounds in the jaw, and even difficulty opening and closing your mouth. And let's not forget about the long-term health of your teeth. Misaligned bites can lead to uneven wear and tear on your enamel, the protective outer layer of your teeth. Over time, this can increase your risk of developing cavities, gum disease, and even tooth loss. So while a slightly imperfect smile is nothing to be ashamed of, addressing significant overjet or overbite is crucial for maintaining optimal oral health and overall well-being. Chapter 5. How to prevent and correct overjet and overbite, taking action for a healthier smile. The good news is that overjet and overbite are treatable, and early intervention is key. Let's explore some ways to prevent these conditions from developing in the first place and how to correct them if they're already present. Prevention starts early, even before a child's permanent teeth erupt. If you're a parent, encourage pacifier weaning by 12 months of age and transition from bottles to cups by the time your child turns 1 year old. These simple steps can significantly reduce the risk of developing bite problems later on. And as tough as it might be, helping your child stop thumb-sucking before the age of 4 is crucial. The longer the habit persists, the greater the chance it will affect their developing teeth and jaws. Positive reinforcement, gentle reminders, and even seeking guidance from a pediatric dentist or therapist can help make this transition smoother. Now, for older children and adults who already have an overjet or overbite, there are effective treatment options available. Orthodontics is often the go-to solution, and thanks to advancements in technology, there are more choices than ever before. Traditional braces with their brackets and wires are still a reliable and effective way to move teeth into proper alignment. But for those who prefer a more discreet approach, clear aligners, like Invisalign, offer a removable and virtually invisible alternative. In growing children, sometimes growth modification devices are used. These appliances work by gently guiding jaw growth to correct discrepancies between the upper and lower jaws. Think of them like retainers but with a bit more influence on jaw development. And in severe cases where the underlying skeletal mismatch is significant, jaw surgery might be recommended. This procedure involves repositioning the jaw bones to create a more harmonious bite and facial profile. It's typically reserved for adults after jaw growth has stopped. But orthodontic treatment isn't just about moving teeth, it's also about retraining the muscles in your mouth to function properly. This is where myofunctional therapy comes in. It involves a series of exercises that target the tongue, lips, and facial muscles, helping to correct tongue posture, improve swallowing patterns, and enhance overall muscle balance. Remember, achieving a healthy and functional bite is a team effort. By working closely with your dentist, orthodontist, and potentially a myofunctional therapist, you can address the underlying causes of overjet and overbite and achieve a smile that's not just beautiful, but also healthy and functional. Chapter 6. Your best smile awaits. So there you have it. Overjet and overbite can be influenced by both genetics and habits, but with the right knowledge and action, they can be managed effectively. If you or your child has a bite issue, consulting an orthodontist early can make a huge difference. Early intervention is key, whether it's breaking habits like thumb sucking or seeking orthodontic treatment to guide tooth and jaw development. Remember, a healthy smile is about more than just aesthetics. It's about feeling confident, chewing comfortably, and maintaining good oral health for years to come. Did you find this video helpful? If so, make sure to like, share, and subscribe for more in-depth health and science content. And don't forget, your smile is an important part of your health, so take good care of it.